very early on, we talk about how family planning is allowed in Islam, how family planning is not forbidden in Islam religion, and we talk about the evidence behind it. We use verses that show that. So when people come in, we know this is going on in their head. We know as they're sitting there, they're thinking, is this allowed? Isn't this allowed? How do I talk to a man in rural areas about family planning? So we give them the tools. We prepare them so when they do talk to ordinary Afghan men, they will be able to educate them and tell them how they can contribute to their families. And there's also, I think, there's a lot of misconception about Muslim men in general and Muslim communities in general. One of the strategies that we use to work with people that we're training in family planning and reproductive health, these are men, male doctors and nurses, is that we discuss that it's permitted in Islam. And an example we use is the example where there is clear evidence that Prophet Muhammad encouraged his followers to use birth spacing. And at that time, of course, there were no modern methods available, so he was encouraging the withdrawal method. So we discussed this, and people are very interested in learning that Prophet Muhammad has spoken about it, who has said to use this method so you have space between having children. There are some other verses also that we use, but this is the type of thing that we address at the very beginning of the workshop, because we know that many of them are thinking, is this allowed? Isn't this allowed? So we put their minds at rest at the very beginning. What I wish for is for culturally sensitive programs throughout that region. And I think we can do it. I think if we make it one of our priorities, we will have a much better outcome in all of our development programs, especially now with what is happening in the region. We had a midwife who came from a province that security was an issue and there were Taliban checkpoints. She was concerned that she would be stopped and searched. And this came about, this conversation came about because we had asked them to bring certain things, including pen and paper for the workshop. And it was part of what we wanted to show as a discipline, not that we couldn't provide them with pen and pencil, but we wanted them to follow a certain guideline. She came to the training program without anything. And when they came to me and they said, you know, she didn't bring anything, not even her coverall for clinical work and so on, I pulled her aside and I said, you know, didn't you get the memo? Didn't you get? She said, I did, but I was afraid that if I was stopped by the checkpoint and they will see pen and pencil and even dollars on me, they know I can read and write. They'll know that I'm educated and I will get into trouble. And that to me, and I thought, here I am worrying about why is she following our protocol, and she's worrying about being stopped by the Taliban and getting into trouble. So you really have to give these women a lot of credit, the women that are working at the ministry, a lot of women that are working in the field. When I visit these clinics, the midwives and doctors, the female doctors, what they have to deal with to be able to do their jobs. And why do I do it? My family thinks I'm a little crazy because I do this, but I think I feel a sense of commitment. I feel also that I can make a difference. The Deputy Minister of Health in Afghanistan told me one day, she said, Tarana, you're good for Afghanistan. And I took that to heart. And when I'm here, I'm thinking of the people there, and I'm thinking of how can we help them. And I think the fact that I see that we can actually help them. This is not a hopeless situation. There is hope. There are things that we can do to make a difference. I also want to say that I admire Afghan women. I admire their strength. I admire how brave they are. These women that we train, the ones that come to our training program, are much more brave than I am. I mean, I don't consider myself brave. Maybe to the Western world I am brave, but to me they are my heroes.